Apnea is the Greek word for "I want of breath," which was first introduced in 1965. Sleep apnea is a respiratory pauses disorder that results in a respiratory failure during sleep. This pause takes more than 10 seconds and can happen for any reason. During sleep apnea disorder, we aren't able to receive oxygen and are not able to exhale carbon dioxide. This resulting in decreased oxygen levels in the blood and elevated levels of carbon dioxide in the blood. Decreased oxygen and increasing carbon dioxide alert the brain to breathe again. In this way, the brain sends a signal to the upper respiratory muscles to open the airway and the respiratory system reactivates. This is often done with loud snoring or to panting. There are many types of apnea, two of which are central and obstructive. A. Central sleep apnea. In this type, the brain cannot send adequate signals to the respiratory muscles to begin breathing, and the individual may experience respiratory interruptions. This type of apnea is less common. B. Obstructive sleep apnea. Occurs when airflow cannot enter or exit the nose or mouth during sleep. When the muscles at the bottom of the tongue and the small tongue, small fleshy hanging from the center of the throat, loosen, breathing is blocked, in which case one's breathing will be accompanied by noise, and even the stop will be accompanied. In people who are obese, sleep apnea is more common because more tissue is found in the airways and narrows the respiratory tract and makes breathing more difficult. This type of apnea is far more common. In this case, the person does not get enough sleep, which leads to feeling sleepy during the day. Maybe at 1 hour, the number of respiratory breaks or apnea events is 20 to 30 or even more. This breathing pause is almost always accompanied by snoring, although it may not be snoring. Sleep apnea is characterized by a feeling of suffocation. Symptoms of sleep apnea disorder. Often people obstructive apnea do not remember apnea attacks during the night. These symptoms include snoring long, breathing discontinuation courses, morning headache, abnormal daily sleepiness, including falling asleep at inappropriate times, weight gain, decentralization, memory problem, personality changes. Diagnosis. Despite many symptoms, it is not easy to diagnose sleep apnea, and nearly 18 million Americans have sleep apnea. However, few are diagnosed. Early diagnosis and treatment of sleep apnea are important because it can control the consequences of sleep apnea. These include depression, irritability, sexual dysfunction, memory problems, learning and more. Up to 50% of sleep apnea patients have high blood pressure, as well as a higher risk of heart attack and stroke in people with sleep apnea. Sleep apnea occurs in all age groups in both men and women, but is more common in men. People with this disorder include those who snore loudly, have overweight or hypertension, or some physical abnormality in the nose, throat, or other parts of the airway. Sleep apnea seems to be genetic in some families. Polysomnography is a test that records a variety of body postures during sleep, such as brain electrical activity, eye movement, muscle activity, heart rate, respiratory effort, airflow, and blood oxygen level. This test is to diagnose sleep apnea and determine its severity. Treatment of sleep apnea disorder. The purpose of treatment is to keep the airway open to prevent sleep apnea. Specific treatments for sleep apnea are designed based on one's medical history, physical examination, and results of polysomnography. Medication for apnea disorder rarely responds. Also, in some cases, oxygen treatment may help the patient a little, but it cannot eliminate sleep apnea. Therefore, the role of oxygen in the treatment of sleep apnea is controversial. The efficacy of treatment is very important, which is done by polysomnography. For mild cases of obstructive sleep apnea, they are urged to avoid sleeping on the back. For people with significant nasal congestion, anti-congestion therapy is prescribed if necessary. Patients with central obstruction and apnea should avoid alcohol, sedation, and drugs. It encouraged weight loss and diet control for overweight patients. Many serious cases of obstructive sleep apnea can be treated with a treatment called continuous positive airway pressure, CPAP. In CPAP, using a mask-like device and pump that keep the airway open with air pressure, but in more severe conditions, surgery can help the patient by removing the obstruction or removing or reducing airway stenosis. Here are some simple ways to reduce sleep apnea. Lie to the side. Because this will open the airway. Before going to sleep, swallow your mouth saliva. In some people, saliva in the back of the larynx collects and prevents breathing. While sleeping, straighten your spine from the first neck vertebra to the end of the waist vertebra. The curvature of the spine, especially the neck vertebra, narrows the respiratory tract and can aggravate sleep apnea. Thank you for watching this video. I hope to answer mainly question. Please feel free to comment below in this video, and also we will be glad to subscribe by click on subscribe button to find more video around health and psychology topics. Be careful and enjoy your life.